Assalamu alaikum. I hope all of you are doing well. Today we are going to continue with the musculoskeletal system, specifically continuing the upper limb. And today's topic is humerus. So, humerus is the longest and the largest bone of the upper limb, and it continues from the shoulder joint till the elbow joint. It is the only bone which is present in the arm. Uh, it is very important in the movement of forearm and arm, in the movement of shoulder joint and elbow joint, because many of the muscles which move the shoulder joint or elbow joint have insertion or origin from this bone. Moreover, all the blood supply of the forearm, of the hand, and all the nerve supply of the forearm and hand uh, goes from the shoulder joint to the forearm through its grooves. So, without any delay, let's start the studying the structure of humerus. So, if we look at the humerus is divided into three parts. The first one is the upper end, then the shaft, and then the lower end. Okay, so let's start with the upper end of the humerus. If we talk about the upper end, the head of the humerus is the first part that we can notice here, that we are going to discuss here. This is the head. It is circular in shape and is present in the glenoid cavity. It is directed medially and upwards and backwards. Okay, so here you can see we cannot see most of the head because it is directed upwards and backwards and medially. Basically, it means it makes up 1/3 of the total glenoid cavity. Glenoid cavity is the cavity that is present in the scapula, and head interacts with it to form the shoulder joint. Okay, so the structure that is immediately present after the head is the anatomical neck of the humerus. This one is the anatomical neck of the humerus. This line is anatomical neck. Anatomical neck is basically a line, an imaginary line you can say, that separates the head from the rest of the humerus, from the rest of the upper end of the humerus. On the contrary, there is another structure that is known as the surgical line. Surgical line is that line that separates the head of the humerus from the shaft of the humerus. Here you can see the surgical line. This is point 6. 6 number line is surgical line. Surgical line is the side where the fracture of humerus is more common as compared to the anatomical neck. So surgical neck is more easily fractured as compared to the anatomical neck. Okay, now below the anatomical neck, laterally located, is a structure that is a little raised and located a little posteriorly. This one. This structure is known as the greater tubercle. Tubercle is a kind of a raised, rough kind of surface on a bone where muscle origin or insertion takes place. Okay, so tubercle are raised structures. आप कह सकते हैं जैसे छोटी छोटी पहाड़ियाँ कहीं पे ज़मीन पे बनी हुई हो, small mountains kind of things, dunes kind of structures, and in between those there is a depression that is known as a sulcus or known as a groove. Okay, so here we can see the greater tubercle of the humerus, which is laterally located and posteriorly located. On the other hand, the lesser tubercle is smaller in size, more flatter, and it is anteriorly and medially located. Okay, so keep in mind the greater tubercle is laterally located, whereas the lesser tubercle is medially located. In between the tubercles, there is a groove, there is a depression. This is known as intertubercular sulcus or bicipital groove. Okay, this is basically a depression that separates the greater tubercle from the lesser tubercle. Okay, so these are the structures which are present in the upper end of the humerus. What are these? We've discussed it earlier on. This is the acromion process of the scapula that forms the acromioclavicular joint, and this is the coracoid process of the scapula. Okay, where the ligament is located that connects the scapula to the clavicle. Okay, now let's discuss the shaft of the humerus. So if we look at the shaft, the structure that is present between the upper part and the lower part of the humerus is known as the shaft of the humerus. Shaft is basically a long cylindrical kind of part that is rounded in the upper half from here to here and triangular flatter in the lower half. Okay, so as you can see, this is more round as compared to this triangular kind of thing. So from here it is more flatter, more triangular. So let's see what structures are located in the shaft. So the first structure that we can see in the shaft is this deltoid tuberosity. What is tuberosity? Tuberosity is basically a rougher surface where there is insertion of a muscle. Here, the lower end, the insertion of the deltoid muscle takes place on the humerus. That's why it is known as deltoid tuberosity. It is located alongside the anterior border and it is present just laterally to the intertubercular sulcus. If we see it from the other side, we'll see that it is laterally located to the intertubercular sulcus. Okay. Then the second structure that we can see here is the radial groove. What is radial groove? Let's discuss this now. Radial groove is the groove through which radial nerve comes down to supply the hand. Radial nerve basically supplies the posterior compartment of arm, forearm, these muscles, and skin. So it is important in the extension of the forearm and arm. So if the shaft gets fractured, most probable structure that would be affected is radial nerve, and we would lose the extension of most of the forearm and wrist joint. So this is also clinically very important structure. Okay, the third structure here, basically these two you can say ends, these two elevations are known as condyles of the humerus. So these structures of the shaft which are present immediately above the condyles are known as condylar supracondylar ridges. Supracondylar means above the condyle and ridges means रिज बेसिकली कहते हैं ढलवान को, ठीक है. सो इट इज़ काइंड ऑफ डिसेंडिंग काइंड ऑफ structure. So medially the medial supracondylar ridge is located, and laterally the lateral supracondylar ridge is located. There is not much that needs to be discussed from the shaft. The important structures from the humerus are the head and the upper end and the lower end. From the shaft you just have to remember the radial groove through which the radial nerve passes. Okay, now let's discuss the lower end. Now lower end is a bit confusing as compared to the upper end, and it is no doubt a very important structure that needs to be memorized. Okay, so if we discuss the lower end, we can see there are many elevations and many regressions or depressions within it. So we'll start from the lateral side and go towards the medial side. Okay, so let's start with this first structure. This structure is a kind of a rounded projection where the radius is going to be attached with the humerus. So head of the radius articulates with the humerus. Basically the lower end is divided into two parts. The articular part, which takes part in forming a joint with the radius ulna, and the non-articular part that does not take part in forming the joint. In the articular part there are two structures that are present. First is the capitulum and the second one is trochlea. One for the attachment of radius, the second one for the attachment of ulna. So this one is the capitulum, where the radius comes and attaches, the radial head comes and attaches with the humerus to form the elbow joint. The second structure, which is not so round in shape, it is basically where the ulna would come and attach with the humerus. So here you can see this structure is medially located. So ulna would attach here and radius would attach here. Now let's discuss about the non-articular part, which does not take place in forming a joint. So those structures are, as I told you earlier, there are two epicondyles. There is a lateral epicondyle and there is a medial epicondyle. Let's discuss the lateral epicondyle. It is smaller in size as compared to this one, medial epicondyle. As you can see here, lateral epicondyle is smaller in size as compared to the medial epicondyle, and here some muscles would come to attach, as we'll learn later on. On the other hand, the medial epicondyle is a very prominent structure. You can feel it if you try to feel your humerus. It is a kind of a elevation, and it is subcutaneous in nature. Just located below the skin. So these are two epicondyles. Now the part which is located just above the epicondyles forms a ridge, kind of a ridge, that is known as the supracondylar ridge. On the lateral side, it is known as lateral supracondylar ridge, and on the medial side, it is medial supracondylar ridge. Now the important structures here are this radial fossa and this coronoid fossa. Basically, radial fossa is the depression in which the head of the radius is going to be attached when the elbow is flexed. So head of the radius is like a hook. When we flex our elbow, the upper part of radius that articulates with this joint that gets fixed in this radial fossa. Coronoid fossa accommodates the coronoid process of ulna, basically. And if we talk about ulna, there is another structure that is important here. If this was the anterior surface of the lower end. If we discuss the posterior surface, here you can see there is another structure that is known as olecranon fossa that lies posteriorly just above the capitulum and trochlea. This is basically olecranon fossa. Olecranon fossa accommodates the olecranon process of the ulna. So olecranon process of ulna comes here, coronoid process of ulna comes here, and head of the radius comes here. Now trochlea and capitulum we know it already, and there is a groove through which the ulnar nerve descends into the elbow joint that is known as groove for the ulnar nerve. Okay, so here let's revise these structures of the head. It is very important, so try to memorize it by heart, and let's see if you can predict what structures we are going to discuss now. Okay, so number 1, what do you think it is? The first structure here is the greater tubercle that is located laterally. The second one is this one. What is it? What do you think? It is the surgical neck of humerus. Then this one, this is an easy one to guess. This is the shaft. Okay, now let's see what this is. What is this? This is the greater tubercle, and then this one is an easy one. It is the intertubercular or bicipital groove. Then located medially to this one is the lesser tubercle, and then there is this line. What is this called? The anatomical neck of humerus. And at last, the number 8 structure here is the head of the humerus. So if you guessed 4 out of these 8 structures correctly, it means you're paying attention to the lecture. So now let's talk about the lower end of the humerus. So try to guess the structures. What is number 1? The number 1 is the lateral supracondylar ridge. And see if you can tell which one is the anterior picture and which one is the posterior picture. The second one is the olecranon fossa. Now it would be clear which one is anterior and which one is posterior. Then this is the lateral epicondyle. These two are very important. Trochlea and capitulum. Sorry, here they mark the medial epicondyle. Capitulum is marked anteriorly on the next part. So number 6 structure, this one is coronoid fossa. Then there is the radial fossa, and then there is the capitulum, and the last one is medial supracondylar ridge. So let's see if you can predict these ones too. So which part is it, proximal or distal? So by now you should know what is proximal, what is distal. Proximal is any structure that is closer to the center of the body. For example, shoulder would be proximal as compared to the elbow joint. Elbow joint is distal to the shoulder joint. Okay, because distal is away from the center of the body, from the axial skeleton. So this is the proximal end or upper end of the humerus. This is the shaft of the humerus, the deltoid tuberosity that is bulging on the lateral side. Then there is the shaft of the humerus, and this one participates in making the which joint? Elbow joint. Okay, now let's talk about the attachments on the humerus. The different muscles or ligaments which are attached with the humerus. Let's talk about those. So अगर हम बात करें यहाँ पर इसकी, two types of muscles are present here. First, उन muscles की insertions होती हैं. There are insertions of those muscles which make up the shoulder joint, and then there are origins of those muscles which would pass through the elbow joint and move the elbow joint. So it is essential for the movement of shoulder joint as well as the elbow joint. Okay, one more thing, sorry. We'll talk about the movements of the upper arm in detail, inshallah, in the next lecture. Okay, so I'll make sure to talk about those. Okay, so let's see the muscles which are present here. Okay, so here in the upper half we can see there are the insertions of the muscles which move the shoulder joint. The subscapularis, let's talk about the first muscle. Okay, so the supraspinatus muscle is inserted onto the greater tubercle, the upper part of the greater tubercle. This is the greater tubercle, this is a lesser tubercle, intertubercular groove. So this muscle which is attached, which inserts at the upper part of the greater tubercle, is the supraspinatus muscle. Then the subscapularis muscle is inserted in the lesser tubercle. Here we can see this insertion is here. The next muscle that comes is the pectoralis major, that is inserted laterally to the intertubercular sulcus or intertubercular groove, whereas the latissimus dorsi is inserted on the floor of the intertubercular sulcus below the lesser tubercle. Teres major is present medially to this intertubercular sulcus. This is the intertubercular sulcus. Okay, what is present in the intertubercular sulcus? Basically, there is a tendon of the long head of biceps, and then there is a synovial sheath that covers that tendon, and an artery is also present in the intertubercular sulcus. It is running downwards. Okay. Now, this muscle has its own attachment place. This is the deltoid muscle, and it attaches at the deltoid tuberosity. Deltoid tuberosity is basically a rough patch that is raised, and it is present on the lateral part of the shaft of humerus. On the medial side, the coracobrachialis is located on the medial border. So these were the insertions on the anterior side of humerus. This was the anterior side. This is the anterior aspect. Now let's see the origins of the muscles. So a muscle that covers the large area is a brachialis muscle. Brachialis muscle basically covers the anteromedial as well as the lateral as well as most of the anterior area of the lower end of humerus, lower end of the shaft of humerus. Okay. Okay. Then there is another muscle that originates from the uh, lateral supracondylar ridge, the upper part of the lateral supracondylar ridge, that is the brachioradialis. Okay. From the lower part of the lateral supracondylar ridge arises the extensor carpi radialis muscle, and from the medial side we can see there is a brachialis muscle. Here all the medial supracondylar ridge brachialis muscles origin takes place. Okay. Pronator muscle, pronator teres basically is present or arises from the medial supracondylar ridge, and then there are some muscles which have a common origin. There is a group of muscles known as the superficial flexor muscles that arise from the medial epicondyle, whereas the superficial extensors arise from the lateral epicondyle. So these are the common origins of these muscles. Okay, now uh, as we've seen the name of the muscles, we can predict what are they going to do or where they are inserted or where they originate from. For example, the extensor carpi radialis longus is the muscle that is an extensor muscle, helps in extension of the joint. Which joint? The joint between the carpi and the radial bone. So it runs along the radial bone, attaches with the carpals, and it is the longer muscle in this group of muscles. Remember, longus is the longer muscle, brevis, brevis, brevis is the smaller muscle. So there is a extensor carpi radialis longus, there would be a extensor carpi radialis brevis. Same as this one, there is flexor carpi ulnaris also. So it is like that. Okay, so let's discuss some muscles which have origins and insertions on the posterior aspect. So out of the box we can see that on the posterior aspect, supraspinatus, infraspinatus, and teres minor muscle, these ones, they insert at the greater tubercle, whereas this muscle, this is the lateral head of triceps, it inserts at the you can see near the intertubercular groove. So it is inserted above the intertubercular or the radial groove. Okay. Then there is the insertion of the deltoid muscle. Basically triceps arises from here. Okay, so this is the origin. So the lateral head arises above and from the radial groove, whereas the medial head arises below the radial groove. Then same as the anterior aspect, brachialis originates from most of the posterior aspect also. Then there is the common extensor origin located laterally, and common flexor origin located uh, medially. Moreover, there is an conius muscle that arises from the posterior surface of lateral epicondyle. Okay, so these were the common muscles which attach here. Okay, another topic that is very important related to the humerus and the aspect of the study of the humerus is the common fractures of the humerus and the common ailments that arise due to these fractures. So let's discuss those. So first we have to uh, have some knowledge about the anatomy of the clinical of the nerves that run through the humerus. So if we look at the humerus, there are different nerves that run through different parts of the humerus. For example, as we can see here, the ulnar nerve. Ulnar nerve crosses the elbow joint near the medial epicondyle. Basically, it is located behind the medial epicondyle, and it is a very common site of injury of the ulnar nerve. If the patient falls out, especially a child falls out with outstretched hands, the ulnar nerve may get damaged due to supracondylar fracture. So wherever we are discussing supracondylar fracture, the most probable structure um, that is affected by this is the ulnar nerve. Similarly, the radial nerve runs through the radial groove. So, any fracture to the shaft of the humerus here would result in damage of the radial nerve, and any fracture of the surgical neck of humerus would result in the damage of axillary nerve. So here maybe we can see, here you can see this is the axillary nerve. If there is any damage to the surgical neck of the humerus, axillary nerve would get damaged. And what muscle it supplies and what happens when the axillary nerve gets damaged, we'll study it in regional anatomy when we study the muscles completely. So here we can see the radial nerve. It mostly gets damaged due to damage of the shaft of the humerus. So three nerves can get damaged. First, there is the axillary nerve. It gets damaged if there is fracture of the surgical neck of humerus. Then there is ulnar nerve gets damaged in supracondylar fracture or any injury to the medial epicondyle of the humerus. Then there is the radial nerve that gets damaged due to fracture of the shaft of humerus. Yeah, that thing is discussed again. Damage to axillary nerve takes place if there is damage to surgical neck or there is fracture of the surgical neck. If there is fracture of the shaft, it damages the radial nerve. Here you can see it. And this happens in the damage of radial nerve. Basically, it is responsible for the extension of the wrist joint, so there would be wrist drop seen in the damage of radial nerve. If there is damage to supracondyle, medial supracondylar structures, medial supracondylar ridge, it causes damage to the medial. Uh, sorry, it causes damage to the ulnar nerve. And other two things which we'll study further uh, would be Walkman's ischemic contracture that occurs due to damage of different nerves and myositis ossificans. Here the damage of supracondyle is shown. Here you can see when the lower end of the humerus gets damaged, supracondylar ridge gets damaged, it would result in damage to the ulnar nerve. Here you can see the Walkman's ischemic contracture. Okay, so uh, if there is damage to the supracondylar ridge or supracondylar region, it can cause damage to ulnar nerve or median nerve sometimes. Mostly ulnar nerve is damaged if there is the involvement of medial supracondylar ridge or medial epicondyle. There may be Walkman's ischemic contractures may form and myositis ossificans may occur. Myositis ossificans is a condition in which there is bone formation within the muscle. After injury, after injury to a larger muscle, there is the hematoma formation within the muscle. Within that hematoma, sometimes there is calcium deposition and formation of bony like tissue. That is known as myositis ossificans. Walkman's ischemic contractures we'll see here after the injury to the supracondylar region of elbow. There is sometimes ischemia of the muscles, means uh, blood supply is compromised to uh, the muscles adjoining the elbow joint. Due to compromised muscle supply, death of some tissues takes place, and there is a formation of permanent contracture. The muscles go into contracted form and they remain like that forever, and they are shortened in length and form a fibrous like tissue, blackish fibrous like tissue, and hence that results in this particular claw like deformity of the hand that is shown here. This one here, there is formation of the contraction. Okay, fracture is a condition in which there is damage to the integrity of the bone. The surface of the bone does not remain the same, it gets discontinued at some point. That is fracture. Whereas if the bone's structure is intact, but the point where they are articulating, forming a joint, the misalignment of that point takes place, it is known as the dislocation. So for example, the radius and ulna should communicate directly, should be attached with capitulum and trochlea of the humerus. If this position gets disorganized, if the humerus gets radius ulna get rotated and this position is disorganized, as in the case of this weightlifter, it is known as dislocation of the bone. Same is in the shoulder. This head of the humerus should be inside the glenoid cavity of the scapula. Here you can see it is located inferiorly as compared to the normal point where it should be. This is dislocation of the shoulder joint. Okay, this is dislocation of the elbow joint. Okay, another thing that we need to study about the elbow is the triangle of elbow. So three structures basically they make up the triangle of elbow, also known as the Humerus triangle. The lateral epicondyle, medial epicondyle and orecranon. When the arm is extended, when the elbow is extended, elbow joint is extended, we can see all these structures align with each other. But when the elbow joint is flexed, they form a triangle like structure. This is known as the Humerus triangle or the triangle of elbow. Now radius and ulna remains, we'll study it in the next lecture inshallah, and we'll complete the forearm then. Till then, please revise and study again and again, because I am saying that you people are not paying so much attention to the lectures and you people are not revising. So on Monday, inshallah, there would be a test comprising of roughly 30 MCQs. You would be allotted 30 minutes to complete the MCQs, and it would be a online test, I think. And how to follow the procedure, I'll let you know on Monday. The syllabus for that would be from the introduction to anatomy up until the connective tissue. Okay, the topics which we studied this week would not be included in the test. So before the musculoskeletal system up until the connective tissue, muscle, etc., you have to study. और बच्चे वीडियोस आप लोग नहीं देख रहे, मतलब आप लोगों की 60 स्ट्रेंथ है, एंड आफ्टर 2-3 days of uploading the video there are 20 to 30 views maximum. It means either you are sharing the videos by downloading it or you are not viewing the videos at all. तो जो भी हो, मैं यही आपको कहूँगा कि प्लीज़ लेक्चर्स को प्रिपेयर करें. जो टॉपिक्स हम करते जा रहे हैं दोबारा हमने रिविज़िट नहीं करने हैं मोस्ट प्रॉब्ली. सो इन्हें अच्छे से प्रिपेयर करें, क्योंकि आपका एंड ऑफ द सेमेस्टर एग्ज़ाम जो है इन्हीं टॉपिक्स में से आएगा और मुश्किल आएगा. ठीक है, एंड यू हैव टू पास दैट एग्ज़ाम टू गो इन टू द नेक्स्ट सेमेस्टर बिकॉज इट इज़ एन एसेंशियल सब्जेक्ट. एनाटमी, फिजियोलॉजी आर एसेंशियल सब्जेक्ट्स. सो ये अच्छे से स्टडी करें. तो सोमवार को टेस्ट होगा, साथ में सोमवार को जो लेक्चर होगा बेसिकली वो मैं आपको मूवमेंट ऑफ आर्म जो है उसकी एक स्मॉल लेक्चर 10-15 मिनट्स का बना के वो दूंगा. बाकी रेडियस अल्लाह हम नेक्स्ट फ्राइडे को पढ़ेंगे मोस्ट प्रॉब्ली. ठीक है, और बाकी जो MCQs हैं उनमें अगर कोई किसी को परेशानी हो तो हम डिस्कस कर सकते हैं ग्रुप में शाम में सोमवार को. ठीक है, ओके देन, टेक केयर बच्चों, अल्लाह हाफिज़.